is Sarah Fernandez, and I'd like you to imagine what your life would be like without access to medical care. And I don't mean not having access to medical care in the sense that you don't have the health insurance to pay for an operation, but that you have to walk 24 miles to reach the nearest hospital, or that you think you can pay for an operation, but you get there and you realize you can't afford to pay for anesthesia, or you can't afford to pay for sterile instruments. Problems like these are problems that citizens of third world countries face every day. And in many third world countries, the citizens do not have access to medical care. They don't have the medical technology to prevent infectious disease, and they don't have organizations to help in the event of a natural disaster. But luckily, there is an organization called Doctors Without Borders, or because it is a French organization, Médecins Sans Frontières, and this organization can help solve these problems. A problem faced in many third world countries is that there is not access to medical care. In Justine Blandford's article, It's a Long, Long Walk, Access to Hospitals, Maternity, and Integrated Healthcare Centers in Niger, the author explains that the lack of infrastructure is part of the reason why people do not have access to medical care. Many have to travel anywhere from 1 hour to 6 hours to receive medical care, and it is very common for people to walk over 24 miles to reach the nearest hospital. Additionally, many hospitals are understaffed. In the hospital in Burkina Faso, this hospital serves 2,000 villages, and it's staffed only by nurses. And in a recent study titled The Impact of Primary Health Care on Malaria Morbidity, Defining Access by Disease Burden, if we could cut traveling time to hospitals down to 2 hours, we would cut diseases, people getting diseases by 66%. And additionally, medical care is not affordable. A lot of times people will get to these centers and find out they can't pay for anesthesia, they can't pay for sterile instruments, they can't even afford the care at all. And that is further explained in Nicholas Kristof's book, Half the Sky, where he tells more about how medical care is not affordable in these countries. Additionally, there is not adequate medical technology to help prevent infectious disease. In the Bill and Melinda Gates Foundation, they have an article titled Vaccine Delivery that explains that they don't have the trained professionals to administer vaccines, and not to mention the vaccine delivery is expensive because it's hard to reach these places. And this is a problem because one child dies every 20 seconds from a vaccine-preventable disease. And additionally, there's no access to preventative care. So services such as mammograms, vaccines, regular checkups, prenatal care, people don't have access to these services, whether it's because of distance or it's not offered at the hospital. And lastly, there's a lack of relief agencies in these countries. So the government is a primary first responder in the event of a natural disaster. But unfortunately, a lot of these governments do not have the means to respond to these natural disasters. They either don't have the infrastructure or the money. And that is according to Paul Lewis in his New York Times article, Disaster Relief Proposal Worries Third World Countries. So these governments cannot provide the proper response to natural disasters that the countries need. And also there's no proper infrastructure to receive aid in the case of a natural disaster, as you can see from these two photos right here. In James Tulloch's article, The Cycle of Poverty and Natural Disaster, he explains that the reason for famine in many countries is not because these people can't just produce food, but they can't have, their governments cannot provide for them and reach the cities and villages to provide aid. But the thing is that Doctors Without Borders can help, and these are just a few of the ways that Doctors Without Borders can help these struggling countries. But the Doctors Without Borders can help aid those who do not have access to medical care, and they can provide technology for those who can't afford it, and they can respond in ways that relief agencies can't, because these countries don't have relief agencies. And Doctors Without Borders has proven to be effective because it has treated over 100 million patients successfully, and that was in 2014 alone. And that statistic is based off of the Doctors Without Borders website in their article, The Founding of the MSF. And that's why supporting Doctors Without Borders is important. They can help these people in need. And by supporting Doctors Without Borders, you're able to provide help to those people that we can't reach and may be living hundreds of miles away. Thank you. Any questions?
If I donate to Doctors Without Borders, how much of the money donated goes to overhead and how much goes to directly helping the people?
So 20% of funds go to overhead, and the remaining 80% go to the actual organization. So, supplies, doctors, sending them, helping the people.
Good.
Where primarily are Doctors Without Borders? Where do they operate primarily?
So Doctors Without Borders, actually, if you can see, it's kind of hard to see, but all this red area here is where the Doctors Without Borders operates, but it's primarily in Africa and Asia, and India as well.
Thank you.